A running subcuticular suture is commonly used to close the skin. This is often done with a clear monofilament suture such as a 4-0 monocryl on a cutting needle. Use an Adson forceps with teeth in your non-dominant hand and load the suture on a small needle driver in your dominant hand. First, anchor the suture by placing a single deep dermal stitch. Tie it and cut only the free end short. This will bury your knot. Next, load the needle backhand and place a stitch from deep to superficial at the apex, coming out at or near the epidermal-dermal junction. Now, you will snake the suture from side to side at the level of the epidermal-dermal junction in order to reapproximate the skin. Load your needle forehand. Grasp the skin edge with your forceps a small distance away from the apex and evert the skin to expose the epidermal-dermal junction. Starting at the apex, cock your wrist back and drive the needle in at the level of the epidermal-dermal junction on that side. Turn your wrist to advance the needle and let the curve of the needle do the work. Direct the needle so that it exits at the epidermal-dermal junction. Grasp the needle with your forceps and reload the needle. Now, on the opposite side, grasp the skin edge and evert it, showing yourself the epidermal-dermal junction. Introduce the needle directly horizontal to where you exited on the first side, or slightly in back of it. Do not start in front of where you exited on the other side, because there will be a gap in your closure. As you did on the other side, advance the needle the same way, turning your wrist and letting the curve of the needle do the work for you. Grab and reload, and take your next bite on the other side directly horizontal or slightly in back of where you exited on your last bite. Continue to do this, snaking the suture from side to side at the level of the epidermal-dermal junction. If you want to avoid grabbing the needle with your forceps, use your forceps to grasp the skin edge near where the needle is exiting. This will stabilize the needle. Advance the needle through until about 2/3 of it is through the skin. Then, with your needle driver in the pronated position, grasp the needle directly above the skin, ideally at an angle so as to optimally load it for the next bite. When you near the end of the incision, place your final bite and come out the apex at the other end. You may have only a small bite left to take. To place the last bite, choke up on the needle so that there are only a few millimeters between the tip of the needle and the needle driver. This will give you better control. When you come out the apex, do not pull the suture all the way through. Leave a loop to perform an Aberdeen or fisherman's knot. To do this, release the needle from the needle driver and put the needle driver down. Grasp the needle end of that suture taut with your non-dominant hand. With your dominant hand, place your fingers through the loop and grab the suture being held taut with your other hand and pull the strand without letting go with your other hand. As you do this, the loop will tighten and you will create a new loop with the strand you are pulling. Do this maneuver a few times. Then, to lock the suture, pull the entire suture needle through the loop and tighten. Then, reload your needle on your needle driver. Drive the needle from within the wound at the apex and take a nice wide bite of tissue coming out through the skin. Cut the suture flush with the skin surface to bury the knot.